How many months do you think he's going to save? And he's a
To
family
have
man. So have
500k, yeah.
500k. So take, for example, he's earning the minimum wage. Can he afford 500k if he's not stealing? Hi guys, my name is Jane.
And my name is Abigail.
And
are
are
we
we
on
on
the
the
same
same
page?
page? In Nigeria today, sickness is no longer a medical crisis but an economic one. Families are forced to choose between life and money. I'm wondering, why does staying alive have to cost this much? We'll find out. Why do hospitals in Nigeria insist on payments before treatment, especially even in cases of emergencies?
Yeah, I think basically it's because a lot of hospitals run without government subsidies. So most of these hospitals have to run using out-of-pocket payments that when the patients come in, whatever the patients pay, that's what they are using to run. So it's going to be difficult because you can't really bank on that to run a hospital. If the government is, the subsidies are applying to hospitals, more money is coming in and the hospitals run better. So yeah.
But shouldn't life come before billing?
Yeah, no, necessarily, like it's supposed to be like that. Normally, life should come before billing. In other countries, you see where the doctors are focused on saving the patients before payment.
Before
So
payment, yes.
patients are treated and then payment comes later. But I think because Nigeria doesn't really have any policy on ground being enforced that patients should be treated first, most of these hospitals hide behind that to insist that payment has to be made. And if you run your hospitals like that, there are going to be loss of life.
Yes.
So yeah, I think government really has to enforce laws
They
that
need to
push,
checkmate
yeah,
it, yeah.
to push for patients to be treated before the payment now comes later on. Yeah. Yeah, so Nigeria still has one of the highest mortality rates in the world. Why is that? Do you think is the reason?
I think it stems from poor antenatal care, and a lot of people still rely on traditional treatment. I'm
Okay.
not saying that traditional treatment is bad, because there are a lot of people who in other countries who do the water birth thing, who would prefer
Home
to give
birth
birth
and
at home. But I think a lot of education needs to be had on issues of birth, right? So no, it's just like anybody can just decide and make the decision. I think in advanced countries, when you decide that, oh, this is the route I want to go, the water birth,
yeah,
you have
people,
professionals who
yeah,
will put you through and say, okay, this is how you do it, this is what you do. They teach you the first aids of giving birth in your house. But in Nigeria, if you just decide to go to the mama next door and give birth, nobody knows, the government doesn't know, the baby is alive, baby is not alive, that's the end.
Okay, so what do you think can be done differently to curb, like to help women and families during emergencies to curb the mortality rates?
I think there should be education. The most important thing is being educated on a topic. If there's no one to say, "Oh, this is how you do it," if nobody cares, it's automatic to the mother of the child that, this is my cross to bear.
Yeah,
But if the
true.
government makes it a point of duty to say, "Okay, we're interested in this. We don't want to keep losing lives, and we need to educate women." So I think it should be part of the antenatal treatment and antenatal care. So
Yeah.
there's always the flip side. If you're going to give birth, because we can never tell, the hospital may be how many kilometers away and it happens in the middle of the night.
Yeah, you
So I think there
cannot
needs to be proper education on the
what to
process, on
do
what to do if
when
that
those things
occurs.
arise.
Yeah. But why do Nigerians distrust public hospitals, but they can't afford private ones? What do you think is the reason?
As we all know, public hospitals are underfunded and they are overcrowded. So going there and being sure that you get the necessary treatment is
Treatment,
not really
not
sure.
guaranteed, yeah.
Yeah. Then private hospitals that are properly staffed and can give you your guaranteed treatment are very high. Their costs, their fees are very high. So you can't expect like the average Nigerian to go to a private hospital. They cannot afford that. So yeah, I think that's one of the
But
reasons.
on the flip side, a lot of professionals and a lot of very good doctors are in public hospitals as opposed to private ones. So why do you think Nigerians don't have that trust that, okay, let me entrust my life in their hands, because I know these people are seasoned professionals?
What's the guarantee that if you go to the hospital, the public hospital, the doctors who are there, yeah, you have learned doctors there, but what's the guarantee that those doctors will attend to you? Their complaints of people who have gone to the hospitals from morning and they have been there till late in the evening and they
Yeah.
haven't been
Being
attended to.
attended
So
to.
most of those people have lost, a lot of people have lost trust in the public
So do you think
hospitals.
it's a problem with overcrowding that, oh, they are scared that they will not get treatments in adequate time? Or do you think it's a lack of trust that these doctors will not save my life?
No, they are underfunded first. So you might go there and you cannot get the medications or the treatment required for you to get. That's one discouraging factor. You go there, they can go there, and then the crowd that is there, what's the guarantee that you're going to be attended to
On
urgently,
time.
especially when it's an emergency? That's another discouraging factor. So I think coupled with that, yeah, that's what's
Discourages them. So,
yeah.
so do you think private hospitals operate more like businesses than?
Yes,
You didn't even let me complete the sentence.
private hospitals operate more like businesses because they know that the fee coming in is what they are going to use to run
The
the
hospital.
hospital.
So
So
it's
they,
a
yeah,
business thing. So
they,
do you
for them,
think they treat patients with that mentality?
yeah,
So they're
because
not
if you
worried if
don't
they lose
pay,
a life?
if you don't pay for some, not all, but some hospitals, if you have to pay before you get treated,
Because I
because that's
think
the only way
a
they
lot of
run their
Nigerians think
hospitals.
that it's the public hospitals that are not worried if a life is lost.
No, the public hospitals cannot really help themselves because when you don't have money, you don't have, like, they are overwhelmed to a certain point. Let me put it like that. So it's not like they cannot treat, but they are overwhelmed, they are underfunded, so they cannot help it. Do you
Right.
get? Yeah. So why do you think health insurance is poorly embraced in Nigeria as opposed to other countries?
Because I think awareness is low,
Mhm.
trust is low, and coverage is shallow. What I mean by that is a lot of people are not informed. A lot of people just think that it's for government workers. If you're not working in an organization, you can't pay for health insurance and you
Okay.
don't deserve to have it. It's just your bosses that should pay, or the organization. People don't know that individuals can make those payments
Okay.
ahead for their life, just to secure their life and all. And a lot of people don't trust these insurance companies because they've been bad tales about paying at the end of the day
Yeah.
when they are in a
In a
distress.
fix,
They
yeah, they
don't come
can,
through for
yeah,
them.
it doesn't
And the
cover.
coverage is still the same thing. The coverage
It's
is not as
low, it's
much.
not as
You can
much.
go for a malaria test and you've been paying health insurance for 20 years and they're telling you, oh, it's too much. You need to
You
pay
need,
from out of pocket. So that's the
so
trust. A
all
lot
the
of people
money you
think,
have been putting
so
into that
yeah, so a lot
since,
of
where
people
did it
just
go?
say, oh, whenever it happens, oh, out of pocket payments is the way forward.
Yeah,
So it's that trust that they don't have in health
that's
insurances,
true.
because a lot of bad tales have been spreading around. And I don't
Mm-hmm.
think they are lies, because obviously there's some truth in them.
Yeah,
These people try to scam people. A lot of these health insurance
yeah,
companies try to scam people off
they're
their
having money
hard-earned
and all
money.
that.
So that's the problem. That's basically it. It's not like
Okay.
Nigerians. If there was a good thing
Structure in
in
place, a lot of
place,
people have more
Nigerians will
trust in
embrace
it.
it.
Yeah.
Yes, Nigerians are, a lot of Nigerians do a job. So
Mm-hmm.
if Nigerians can do a job for their life, they will do a job for their
Yeah,
health,
yeah,
right? But
that's true.
they don't trust that that
It will
money will
pan,
come in handy
yeah,
when they need it.
it's true.
Yeah.
So, another question: should 500K be the difference between life and death in the country? Because I'm sure you've heard of the situation where the man lost his wife because he couldn't afford 500K to pay for hospital bills, and a lot of people were bashing him and all that. So, what's your opinion?
First off, why would you expect someone to always have money handy? Did they give the person the money? I'm not saying that he was right, or I'm not saying he was wrong, but nobody can blame him in this
So,
economy for
yeah,
not having money. Because in this
things
economy,
are tight.
the
Things
rich
are.
also cry. So if there's no health insurance in place, why are you blaming somebody because he doesn't have savings of five hundred
Do you
thousand?
even know if the work he's doing can even make he
Yeah.
can afford
First off,
that?
let's ask, what is our minimum wage?
Okay,
So how many months do you think he's going to save? And he's a
to have
family man. So have
500K, yeah,
500K. So take for example, he's earning the minimum wage. Can he afford 500K if he's not stealing? Because he has other bills to pay.
yeah,
So I think that money should not be attached to life.
yeah,
It's sickening.
yeah.
Who monitors hospitals when patients are turned away and neglected?
For Lagos, that's HEFMA, and then nationwide, I think the Medical and Dental Council and then the Ministry of Health is in charge of that, but enforcement is weak. So, of course, things like this will
Or
occur,
slide,
yeah,
yeah.
to slide because they are not enforcing the rules, the regulations that should be.
Yeah.
So, yeah, I think that's majorly one of the reasons why this occurs. Yeah.
Okay. So who holds these government and private hospitals accountable when things go wrong?
We should, as a nation, we should act like true transparency. When things occur, we should report it. But most times, the people do not really have faith. Do not
But they
really.
are
The people do
grieving
not
when
have
things go wrong.
faith.
They are
Yeah, that's what I'm saying.
grieving.
They don't have faith in the government that if something goes wrong and you report it, something will be done about it or it will be taken up. So from time past, there will be people who had reported it, nothing was done. So others have learned from it that if this
Oh,
happens and we
yo.
report it, nothing happens. So
Why
you
waste time?
because of a lack or a gap in the government system, people lose their lives, and the same government do not even step in. They do not seem remorseful. So the
Yeah,
families too also now have to bear the burden of that
of their
loss. Do you
loss
get something that could have been avoided if all these rules, if all these regulations were
were
enforced?
enforced.
Yes. So the government, for me, I think the government really has a lot to do. They have a lot of sitting up to do to be able to put structures in place for this to be reduced, and then for the people to have more faith in the government that we have and the leaders we have running the nation. Yeah.
Nation. But when you say the government, most of these health insurance companies are not run by government.
But
So we
government can
can't.
enforce.
Okay, yes,
Yeah,
they can
there will be
enforce,
a body that can
because I'm saying the
enforce.
people too are corrupt. So it's
Yeah,
a ripple
so
effect.
that's what I'm saying.
Yeah.
So when if people are corrupt and we have a working system,
Yes,
then rules,
they can't escape it.
regulations,
Yeah.
yeah, things will be enforced, things will be done properly. But when everyone, nobody cares,
Mm-hmm.
then it's like everybody, the people in the nation, everybody is on your own.
Yes.
You
Now.
look for what works for you and you toe that line. Basically,
Hmm.
that's how it is. And that's how a lot of people in Nigeria operate right now.
I
That's
guess
the
we're on the
truth.
same page on this.
Yeah, so doctors, when taking their oath, swear to save lives.
Mm.
But we also know that hospitals also need money
To run.
to run. So where's the middle ground between this? How can we find a middle ground between this?
I think the line is stabilization. Most of these people come in for long-term care, so they can start with their immediate treatment and have them detained. Like it's not wrong, but they need the immediate response. That immediate response
Yes,
is
yeah.
crucial.
The difference
So
between life
once
and
once you
death.
once you once you treat, be sure to make sure that, oh, you don't let this person go. You find ways that work for you. If it's your business, you always find a way around it. Whatever business you're doing, you always find. That's why you see that a lot of vendors say, oh, no refund policy. People put policies in place that helps their business
Checkmate,
run.
yeah.
So if you're a hospital and if you're medical institution, and you say, okay, oh, I want to save lives, the first thing you think is saving the life first. The money comes in later, and I know you need money to run, right? But I've heard of situations where hospitals will not let the patients go until they drop money. And there's absolutely nothing wrong in it, because if you let the patients go, nobody's going to reimburse you. So the most important thing is that immediate
Yeah,
response
when they come in, so
when they
that
come
at least
in,
you save a
especially
life
for
and the person
long-term
has to
care.
be
Yeah.
alive for you to
For you to
even
get your
get your
money
money
now,
back.
do you want to
Yeah.
get your money from the dead person? Yeah.
That's true. Do you think there should be a policy in place that advocates for immediate treatment and then billing later once treatment? Anyways, I think you've even answered that. So immediate
Yes.
treatment should policies be put in place
Yes.
to do like to enforce that hospitals treat
Yes,
patients
absolutely.
immediately?
It should be a national law. There's no compromising. It should be enforced. I don't think we should be sleeping on it, because as much as a lot of countries are overpopulated, every life is important. So I don't think we should say, oh, because it's this person. We shouldn't wait until it happens to someone popular.
Yeah,
We shouldn't
before we
wait until
take it as
negligence happens
serious.
to someone that you like. Then you are seeing them on the internet and crying with strangers on the internet. But what was put
Put
in
in
place to
place.
curtail
Yeah,
things like that?
yeah,
That's what we should be thinking about, because a
that's
lot of
true.
things happen and emergencies. People are making videos. The country is not educated about first aid care, emergency care. A lot of people don't even know how
Do
to
CPR, like proper
yes.
CPR.
Honestly, I
So a
don't know
lot
how
of people,
to do
yeah.
CPR, and I'm millennial, and it
Funny
makes
enough, I
absolutely no
just thought of it a
sense.
few days ago that it's necessary for everyone to learn how to do CPR because
Yes.
you don't know where you will
First
find
aid
yourself.
treatment
Do you
is,
get basic
if
first
you
aid
go to other
treatment
countries
should
of
be
the world, you
learned?
see people 19,
Yeah,
they are doing this first aid treatment, and a lot of Nigerians are, some are even in their late 70s, and they don't know
yeah.
the necessary first aid treatment.
Yeah, so I
And
think as Nigerians, we need to learn basic first aid. We need to
yes,
learn what will help us, like in
yeah,
immediate need before we get
And they can start
loved ones
anywhere.
to the
When they
hospital.
want us to vote, they can come to the office and make sure that everybody registers. So why don't they go to the offices, go to wherever people, because a lot of Nigerians, if you tell them to take a day off their work and do these
They will
things,
not.
they will not.
So
But you can find them just the same way you find them
put it
when
in
you want
the
them to vote for you. Find them there. Go to their place of work, go to their offices, give them day off to learn these things, because a lot of lives will be saved.
yeah. So we're on the same page on
Yes, we're
this.
on the same page.
What policies could be put in place to end this deposit or debt culture we have in Nigerian hospitals, where if you cannot make a deposit, that means invariably you have
Yeah.
chosen debt?
I think a National Emergency Healthcare Act mandating treatment before
Payment.
payment. I think that will help. That will go a long way in solving these issues.
Yeah.
If you know that this is the norm, when you walk into a hospital, you know they're not supposed to collect money from you until they're done treating you. I think that will help curtail these excesses.
But sorry, secondly, don't you think Nigerians will take advantage
Advantage of
of
it.
this and then say, you have to treat me, if not,
And there's always a flip side to every
everything, every
policy,
policy
so they just have to find another way, another
to
policy that's going
checkmate
to
suit.
checkmate that,
Yeah, okay,
because
that's
there's always a ripple effect. If you say this, some people say do. So
that's
right,
true. Yeah.
yes.
So, if you were redesigning reform, to put this in, what's the first step you will take to,
Put this in check.
yeah.
Yeah, I would say you ban emergency deposits. Okay, so Nigerians are really deceptive. You can't stereotype them and say, oh, based on how you look.
No,
If you
but you
come in
know that
looking
there are some
scruffy,
people.
if
But
you
when
come
you
in
see
looking
people cannot
scruffy,
afford it, to be honest, when you see people cannot afford
but
it, you
how do
will
you know who
know.
cannot afford it?
When you see this, what do you call them? Is it these abokis on the road that are holding,
Amajoris.
yes, holding bottles, carrying bottles? Those people there going to the hospitals, do you think those people can
So
afford it?
wait, let me get this straight. You're saying that um treatment first should only be restricted to
No,
poor people.
I'm not saying it should be
Rich people can't go
restricted.
broke.
I'm not saying so. I'm just saying there are some
Uh,
people. You know how hospitals will see people like this that cannot afford it, and you're still insisting they must make a deposit.
so that's
It doesn't make
that's
any
physical
sense.
judgment. I don't know if physical judgment will work,
No, I'm not
because
saying use just, but I'm just saying they should also have the sense to know people who, when they see, they know. I'm not
okay, so
saying
if they now see the person that looks good, they should not have the sense. So
this. I cannot even win. I'm not going to
if
go
they now see
because if I continue, we are not going to leave here today. So I'm not like I'm not even answering. I
so
have
if they see the
nothing.
people
I don't have anything
that
to
look
say again.
cool, and
Hmm.
you don't know that clothes they cover secrets.
Do you know whether my clothes is covering my
That's
secret?
that's
But I'm
exactly my
saying that there are
point.
people you know for a fact.
But what
Let's
if
be
those that you don't know
honest.
for a fact need it more
No,
than those
I'm
you know?
talking for
You
the
don't know
one.
that most of these beggars they are rich. It's like you don't know.
All
You
of
are
them
not
cannot go to the
aware.
hospitals at the same time. I'm just saying in situations where someone enters
Me, I
the
feel like
hospital.
it should be equality.
No,
Rich
it's
or poor, you should have
no, I'm
access to
saying
healthcare. Like,
that's a
eh,
basic necessity for
mm,
everyone, be you are rich, you're poor. Medical
mm,
treatments, having access to medical treatment should be like a
a
basic,
staple. Yeah.
yeah, for everyone. I was just saying for people, for
You
doctors
still
who
want
keep
to
on
mention? You still
insisting.
want to mention?
Should hospitals be banned from demanding deposits before treating emergencies?
Absolutely.
Yes.
Yes.
Are private hospitals more interested in money than medicine?
Can't
I
say
don't
or
want.
no.
Yeah.
I can't
I don't
say.
think a lot of them. So I can't say
Yeah, I
yes.
can't
So
say
I'll say
yes.
no.
If a patient dies because they couldn't pay, is the blood on the hands of the government?
Of
Of course.
course. Yes.
Should emergency care always be free at the point of entry?
Yes.
Yes.
Can Nigerians trust their healthcare system today?
No.
Yeah, so obviously we are not on the same page on this, and to be honest, we can't always be on the same
Yes, so
page.
because Abigail likes the poor people more than the rich people.
Ah, did you hear that from me? No,
She thinks the poor people deserve health care
no, that's
and the
not what
rich
I
people
said.
can go and die.
Not from me, from her. So,
So
guys, until we meet again in the next episode, my name is
my
Abigail.
name is Jane.
Bye.
Bye.